As an osteopath, have you ever treated someone and just thought, shut up, just for 10 seconds, can you be quiet and let me focus on what I'm doing so I can help you? I'm sure you might have had that experience, and it's not the patient's fault, because some patients are talkative. Hey, I'm a talker, I love to talk. So I really get that. So it's not to bag the patient, but we need to help the patient out here, because unless they can be quiet, then we're not going to be able to focus properly. But also, another issue is that the nervous system of the patient can't calm and relax and start to sink down, and their healing mechanism starts to activate, which is going to really help the treatment. So it's really important that we can get these patients to be quiet when we need them to be, and to be able to do that without, of course, upsetting them and hurting their feelings. And so I want to run through 4 tips that I use that work really nicely in terms of this situation. Number 1, very simple, lie them face down. You've got the head hole in the bench there, lie them face down with their head in the bench. Because then you can just put your hands on their back. Put your hands on the back, take a big deep breath in, enjoy the silence, and then start into the work. Now while you're doing that, if you don't enjoy silence, or you think they're not going to be able to cope with the silence, then you can just talk what you're doing. So what I'm doing here is I'm just working on your back, I'm working up the spine, and that's really important, because I know you've got that issue with the neck, but obviously the neck connects this upper back, and so we have to work through those areas. So you just lie there and relax while I work through this and get this 100% for you. Do a little bit of commentary. Now what may happen with those patients that are super keen on talking and really can't shut up is they might start lifting their head. So they lift their head off the bench, and sometimes, so their mouth is off and you can hear them, but sometimes they'll lift it off and they'll actually turn it towards you, which is not great for their neck at all, because obviously you're going to get them with a stiff neck or a twisted neck. So you put your hand on their head and you just press their head back down and just say gently, look, just leave your head in there and let it relax, and you explain, if you turn your neck like that, especially if you extend it, it's going to cause problems for your upper neck. And even if they don't come in with a neck problem, they're going to go out with them. So you explain that, and after a few seconds, they get it, and they'll start to relax into that. And for the real talkers, it's gold dust. It's such a great tip, because, boy, their nervous system starts to relax. You just leave them there for 5 minutes and not do anything, and their whole system is getting so much benefit from the fact that they're not 100% fired up all the time. Nervous system, charge. That's part of what's going on for them. They need that break. So that's a great thing to do. Really works to gold. Just start your treatment with that. Okay, tip number 2. And tip number 2 is to work anywhere from here up. Now, there's lots of reasons why you can do that. Even if they come in with a low back problem, you can start to work in this area. Now, if you do that, you can explain to them that is very close to the throat, and obviously when they talk, that's going to affect here and affect down through these areas. And you just say something like this. Right, I'm working on your ribs here, and it's obviously quite close to your throat, and so when you're talking, what happens is it tightens the muscles, and that has an effect all the way down here through where we're working. So if you don't mind, if you could just be quiet for the next couple of minutes. I know that sounds a bit weird, I'm saying that to you, I'm not trying to be rude, but it really will help with what's going on in terms of this technique. And they will, they'll be quiet, they'll be cool with that. Now, after a while, they might forget and start to get a bit, fidgety and start to want to talk and go red in the face. Some people, literally, silence makes them very uncomfortable. So again, you just fill the gap a little bit and explain what's going on. You talk about where you're working and what you're doing, and that allows you then to fill that space, and they'll be comfortable with that. Now that takes us nicely on to tip number 3, and tip number 3 is that you talk. Now that might be a bit weird, because you think, well, if I talk, they're going to talk more and it's going to be bum, 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 bum. But it's not like that. It's not like we're discussing politics or we're discussing religion or even getting excited about a sports team. It's not like that at all. The way you do it is this. They're talking away, going on and on and on, and you're like, oh, cute. And you say, I'm sorry, can I just interrupt you for 1 second, because I really want to explain what's going on here with your low back or your neck or whatever. And then you go into what's going on. They will pause, they'll have to pause because they've actually come in for you to treat them. So it's, they do have this agenda where you're going to help them. And so you're taking advantage of that and saying, just going to interrupt you there for 1 second because I want to explain what's going on with your neck. And then you say, what's happening is that the neck muscles here, that they've got tight because of blah, 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 blah. And so what I'm going to do is I'm just going to talk you through what's happening with this, because it's really key that you understand. Because when you leave, we don't want this dropping back and reverting to how it was before. Because that's often a common fear of patients, especially if they don't understand how osteopathy works. I've had so many people say to me in their osteopathic treatment, they've said, oh, this really great change, thanks for that, but how can we stop it going back? What do I need to do to stop it going back? If you just say to them, I want to explain to you what's going on so that when you leave, this sticks and stays with you and you keep this change that we've got. Then they'll be quiet, and then you just talk to them on what's going on. We've mentioned it a little bit before in the first two tips. You're giving a commentary. I mean, I just do this all the time. I'm a talker, so I often don't even let a patient get going. We'll go through the initial niceties and whatever like that. And not with all patients. Some patients are absolutely fine, but the ones that I know that are talkers, I'll be like, okay, right, this is what we're going to do. And I start saying, I'm going to work on your sacrum to start with, because what's happening is the way that sacrum is turned a little bit, it's influencing the muscles and it's lengthening them on that right hand side. That's coming all the way up into your neck. Now, in addition to that, the latissimus muscle, which again attaches to your sacrum, that comes all the way up into the shoulder. And what that does is, when that actually tightens, it rotates that shoulder and causes this to come in and close in. So that's what's happening all the way through the neck. So now when you're typing, what's happening, you've already got this pattern set up. And so with using the mouse, after only 30 seconds or so, that's why you're starting to get this problem in the neck. Now, I'm doing it quickly for you, you understand all that, but with a patient, I pace that out over 3 or 4 or 5 minutes so that you're not talking all the time, but you're allowing gaps, so you're having a little bit of saying, so what's happening in the sacrum is this. And then you're pausing, having a little bit quiet. And so what I'm going to do is I'm going to work with it in this way. And you don't use the way what I'm explaining to you like you to keep your attention, because it's on YouTube and everybody's got an attention span of 30 seconds and you're going to talk fast. You talk really slow. They're not going anywhere. It's not YouTube. They're there on the bench. They ain't going anywhere. So you lower your pace and you talk slowly. And so it's not just the content of what you're saying that's helping and really sinking into their consciousness and allowing them to understand what's going on, but it's the pace as well, and the pace is calming. And you leave silences in between, and when you stop like this, I won't go on too much, you get the drift here. And so this commentary palpation or palpation commentary is so good at setting the pace of treatment, and it's also a great way of getting the patient to be quiet. And they're like, maybe not consciously, but unconsciously they're like, oh, this is quite soothing. But it's not like you're doing a meditation for them and they're getting upset because don't do meditation on me and don't try and trick my mind to be quiet. I want you to fix me and use techniques. You are doing that, but underneath this, you're pacing it with this kind of meditative way of speaking and this rhythm of speaking where your nervous system drops and their nervous system drops as well. And that's a key thing in entrainment. If you're calm and relaxed, then the other person starts to entrain with that. When we pick up our pace and start talking quickly, what happens, our nervous system picks up. Not necessarily a bad thing, but it's used for activation. So then when you use the pacing like that, that's at the end of treatment when you're trying to motivate them. So Mrs. Jones, what I want you to do is X, Y, and Z. And what I don't want you to do is Y, Z, and W. Because if you do Y, Z, and W, then I'll be seeing you here again tomorrow and you'll be handing over another $100 because what we've done hasn't taken. So there's two pacing. It's when you want to motivate and, kind of agitate a little bit, motivate them with the pain of what happens if they don't do the exercise or if they do something. Okay, so that brings us on to number 4. And number 4 is probably our last choice, but it still works. And number 4 is to say, look, can I just really ask you very politely, could you just be quiet for a couple of minutes because I really need to focus on this. And what I don't want you to do at the end of the thing is that we've had a great chat, and don't get me wrong, I'm enjoying the conversation. I love it when we talk about these things because, you can lay it on, and it depends what they're like. Sometimes you can lay it on a bit thick and they know that you're kidding them. But often you can enjoy having a good chat with patients and they're really interested. But sometimes you need to dial it back so it's not. So you might say to them, just out straight, don't take this the wrong way, but could you be just quiet for a couple of minutes because I really need to focus on what's going on. I'm enjoying the conversation and we're going to pick this up in 2 minutes, but I really need to focus on this and I don't want you going on at the end of the treatment having enjoyed the treatment in terms of conversation, but us not getting where we need to with your treatment. And if you say it like that, genuinely from the heart, people mostly are fine. And the ones that don't, they get really upset, well, maybe you're not the practitioner for them, and maybe they're not the patient for you. So I hope this has been useful for you. If you liked it, hit the like button, and I'll know to do more content like this. There's plenty more on the channel, and I'm going to be doing a lot more content, so check out the playlist there, and also if you like to, subscribe to the channel.